Hi, I'm Blythe Thomas. I'm the Initiative Director at 1000 Days, and I'm here today with Dr. Heather Hamner, Health Scientist in the CDC's Division of Nutrition, Physical Activity, and Obesity. Hey, Heather, how are you?
Good. How are you? Thanks for having me.
Good. Thanks so much for being with us. So we're talking about your recent paper that looked at the importance of the first 1,000 days, and you identified opportunities for improvement. Can you give us a snapshot of why nutrition in the first 1,000 days is so important?
The first 1,000 days starts during pregnancy and it goes through a child's second birthday. And this time period is incredibly important. A child's brain is developing very rapidly during this particular time period, faster than any other time during their life. And we know that there are some key nutrients that are necessary for normal brain development. And if these nutrients are limited, the consequences can include serious birth defects of the brain and spine, increased risk of death, and impaired cognitive development. We also know that for most infants, breast milk is the ideal source of nutrition, and it has significant health benefits for both the baby as well as the mother. Now, as children start to be introduced to the family diet, these early dietary practices and behaviors are also incredibly important, and they can have longer term implications both on later dietary habits as well as some health outcomes. Unfortunately, our data suggest that moms and babies are not meeting their nutritional requirements. But this suggests that there's some opportunities to improve our systems of support for moms and babies in the United States. So our paper looked at some of these opportunities from a federal perspective and identified areas where we can help improve nutrition during the first 1,000 days.
It is such a special and important time, and I'm really thrilled that you've been able to bring this paper forward. You mentioned opportunities for improvements, federal research and surveillance programs, and communication. So let's tackle those. Let's start first with federal research and surveillance. What are the gaps and how can they be improved?
So research and surveillance are really important. They help us understand what populations might need our support, what nutrition behaviors could be falling behind, and where we need to invest or focus our resources. But we have some gaps in our data. So historically, surveys have not included or have had insufficient samples, that means numbers, of pregnant and lactating women, infants, and toddlers, as well as some different racial and ethnic groups. So to address these gaps, some of our existing systems can definitely be modified. So for example, electronic health records can be used to supplement some of our existing data. Another option is doing something called Sentinel surveillance. This would capture data at a smaller level, so meaning not national or even at the state level.
Sentinel surveillance. That sounds like big words. Can you unpack that for me a little bit? Tell me more.
Yes, so Sentinel surveillance is really looking at data at a much smaller level. So we could use this to look at places that regularly serve pregnant and lactating women and children. This might be places like WIC clinics, federally qualified healthcare centers, or even early care and education centers. What Sentinel surveillance could do is help us identify faster what's happening among these particular groups, even if it might not be generalizable or that it may not, meaning that it may not apply to the entire U.S. population, but it can still be a really important tool.
That seems like such a natural place to go. WIC clinics and early care and education centers. That's really important. I'm glad that that's coming out in this paper. What role do federal nutrition programs play in the lives of families in the U.S.?
Yeah, in the United States, the programmatic efforts to support nutrition in the first 1,000 days have really primarily relied on the healthcare system, federal programs that focus on women and children, and by going to the places where children are, like early care and education settings. Again, though, there are some gaps really in the accessing these or participating in these particular programs. And that can lead to fewer families receiving that full spectrum of available benefits, supports, and even clinical care services.
These gaps really can leave people behind. Tell me a little more. What can we do to try and close these gaps?
We thought a lot about this, and I think there are some opportunities that we can consider. One of those is looking for ways to address barriers as well as systematic inequities that make it harder for women to access or even participate in these programs that support nutrition. We have an example of how this was done well recently with the COVID-19 pandemic. So the WIC program instituted waivers, and these waivers helped make WIC services more accessible and convenient for participants. Now, in the healthcare setting, we can also take some lessons from the COVID-19 pandemic. For example, telehealth visits or engaging the healthcare support team to deliver care. And when I say the entire healthcare support team, what I mean is everybody from the front office to the pediatrician. We can also take advantage of some of the data modernization efforts related to our electronic healthcare or health records. So now some of these changes definitely started with the pandemic. Some were in progress before the pandemic, but I think it's really important to think about how we can continue these and help ensure that families get the care they need when they need it. The last idea that we came up with was looking at and identifying promising new interventions to improve nutrition in the first 1,000 days. These could be important to help supplement some of our existing federal programs and potentially reach more U.S. families.
It's really helpful to hear about those innovations. I know that they made such a difference, and I'm so pleased that we can continue many of them. I think it's just critical. Want to talk for a minute. So at 1,000 Days, we work hard to communicate to families about nutrition recommendations, but it can be a real challenge. What did the paper identify as good strategies for addressing communications gaps around nutrition guidance?
Yeah, so our communication efforts really need to ensure that families and caregivers have the most up-to-date recommendations and that those key influencers are providing clear, consistent, and evidence-based messaging. As you said, this can be incredibly challenging. The topic of nutrition during the first 1,000 days is immense. It's complicated, and it's constantly changing. That makes communicating and disseminating messages really tough. So when we were thinking about ways to help address some of this, we thought about making sure that we can identify our key audiences and develop tailored messages to help ensure that we're having that effective messaging. The challenge, though, is we have a lot of audiences. We talk to parents and caregivers. We share information with early care and education providers, with healthcare providers. And even when we think about the program administrators or policymakers, they all need evidence-based information to help inform their decision-making. So when we're thinking about developing messages, all of these audiences have different needs. And so we need to think about that as we're developing these messages and tailoring them to the specific audience. The other thing that we thought about was around dissemination and realizing that dissemination of these messages, it's a collective effort. This means everybody, from federal agencies, state and local governments, nonprofits, professional organizations, the private sector, everyone. We all have a role to play to help us get these messages out and make sure that they're clear, they're consistent, and they're credible.
Well, at 1,000 Days, you have a team that is here to support, and we're grateful to you for all the work that the CDC does and for all this important communications, and we're here to help. But before we wrap up, we started here and I'd love to end here. Tell me again, what would you like to leave this audience with about the role of nutrition in the 1,000-day window?
I think I really want to reinforce with the audience, first and foremost, that this time period is important. Optimal nutrition in the first 1,000 days can have lifelong impacts on the health and well-being of our families. We've had a lot of progress that has been made, but we still have some opportunities. We have some opportunities to work collectively to continue these efforts. And what our paper did was think about how we can advance these efforts specifically related to research and surveillance, program and communication and dissemination, and how we can positively and equitably influence the health and well-being of mothers and children.
Thank you so much, Heather. It's great to have you here, and thanks to you and all your other authors as well, and all of those at the CDC. It's been great, and we're looking forward to the release of all the papers. So thank you again. Have a great rest of your day.
Thank you, you too.